Why the virus exploded again here in Turkey? What are the precautions? What vaccine we will get here? And what will the future be looking here like? All explained again here. So, unfortunately, I have to do again a coronavirus video here, which is very unfortunate and I don't like to do, but well, there's nothing to do about it. The situation has gone out of hand at the moment here. But before going on, please don't forget to subscribe, put a like on it. Would be very grateful if you do that. Thank you very much. And let's go on with the situation here. So first of all, currently we have about 30,000 infections a day and over 30,000. The last report from the Ministry of Health yesterday was about 33,000 infections a day. Now, this has gone up drastically. It's exploded actually since last month. And there's really a very bad explanation for it. It's not because people did not put on masks or anything like that. No, nothing like that. As you remember probably that by the beginning of the year, we had our infections rate about, well, before summer, about 3,000 to 4,000, something like that. And then by summertime, somehow the infection rate got down, like every country, which seems to be normal. But there was some strange little thing which was going on there, especially in the reports what the health ministry was giving. So the point what they changed in their reports was, instead of daily infections rate, they changed the number to daily patients rate. Now you may ask, what's the difference there? Well, you can play with the words and with numbers, and it's changed a huge deal actually. Because what the ministry called as an infection was not the real infection as a patient, was not the infection, but it was more actually the people who got into the hospital and not the infected ones. So everybody who was tested and not got hospitalized didn't count as a patient actually. So they didn't include all the infections from, I think it was something like May, something like that. And nobody realized that really actually. And after a while, things were good, especially in the summer. So now we realized actually, except of the doctors who were at the hospitals and were saying we're getting more and more patients. Not only that, but the infections are going up. And the politics, which is sometimes awful here in Turkey, called them actually that they're lying, that that's not correct, that the health minister is giving the correct numbers and all of that stuff. But as in the last days, now since I think September, October, also the other politicians, the opposition side, was now crying out that the hospitals are now full, the deaths are going up, and there's more infections than you say. The Minister of Health said in one day there actually also that they are not giving the number of infections because it is not good for the psychology of the humans living in Turkey, which is ridiculous. So until beginning of November, we had a number of patients about 3,000 to 4,000 again. And then suddenly they had to change, or better to say, include the numbers of infections again. And then in one day, just like magical, we got a number of 29,000 infections a day when we saw that. But we knew that already, because the hospitals are getting fuller and fuller and it's getting out of hand. And now they're also putting again some closures on the weekends at least. And now today we have a number of about 33,000 infections a day. I think that makes us the third in the ranking in the world actually. Unbelievable, isn't it? So what has happened now is automatically they say, okay, these are the numbers, we have to give the numbers again, and nobody resigns. Well, nobody has ever resigned actually from the government in Turkey. So, okay, I'm closing my mouth. I'm not saying anything about that anymore. So that's the situation at the moment, and that is also the reason why the numbers jumped from 3,000 to 33,000 within a day. Which, I must say, can be also questioned again if these numbers are correct. But this is not something I want to say in this video, because saying such kinds of things here in Turkey, well, freedom of speech, okay, another thing. Now we have that out of the way, and that we are the third in the world in infections. What kind of vaccine are we going to get here in Turkey? We were awaiting that we are going to get some vaccine also from Europe, so from Pfizer, AstraZeneca and all that companies. But no, we are going to get the Chinese vaccine. This is what the health minister has explained us within a few weeks ago. So what we are going to get is one of the Chinese vaccines. I think there are 6 of them. And we are going to get about 50 million doses within this week. Now 50 million doses makes actually 25 million doses actually, because you need 2 for every patient, for every person. So 25 million doses, what they will do is probably first all vaccine all the health stuff, then the elder people and the people who needs medical attention, I think. Everybody else has to wait. Well, the good thing is they're going to give it for free, and that's at least what they said. But I'm not sure if it will, if everybody will get his vaccine. Probably not in this time. They're trying to get some more. Now about this vaccine, let's say I'm going to be vaccinated if they're going to get it for everybody for free. And if we are going to get our hands on it. Because as I said, 25 million per person, well, I'm not sure if we're all going to get it in the pharmacies. So, why I'm going to get it? And first of all, what this vaccine is, it is a traditional vaccine. So, a traditional vaccine, it's not like the mRNA and all the protein-based vaccines which we have from AstraZeneca and from Pfizer. But this is a traditional one. So traditional means basically you've got a dead virus in this vaccine. Now the question is, how effective is it? We don't know anything from China, and probably China doesn't know also, because what we heard is that China hasn't vaccinated their own people, only again the military, the health staff, and everybody who needs it, but not the ordinary people. So we don't know much. What we know about it is they have tested or distributed it to Brazil, to Mexico, to Indonesia and Saudi Arabia. And now we are going to get it. Interestingly, what I have heard is that this vaccine has an effectiveness rate of something like 86%. So it's helpful. And well, for this vaccine, as it is traditional, I don't think that it will have any side effects. I hope so not. I know that some people have been vaccinated here in Turkey with this vaccine. And well, doctors especially, and what is said is that that's the normal side effects they have, so a little bit headache, some dizziness within the first day, and that's it basically. Now coming back, also other vaccines which are going to get to Turkey. So there's an Indian vaccine, I think, which is something like a drop. There's another vaccine which is like a patch they have developed also. But when these comes, how these comes, that's a big question mark. I've also heard that the AstraZeneca and Pfizer will also come sometime, and people can buy them with their own money if they wish to. But if it comes and when it comes, nobody has an idea. From the other hand side, what I have heard about the mRNA and the protein base, so the AstraZeneca and the Pfizer one, is that they have a higher effectiveness rate, but that the duration of how long it is effective is shorter than the traditional ones. So that's very interesting. And that's a point that nobody knows at the world, and we will all together see. Also, what is said is, because there's a question of if, for example, we take the Chinese vaccine, if we could get also another vaccine on the same time, well, let's say a few weeks after, like the AstraZeneca and Pfizer, the answer was from the authorities basically, yes, you can get it actually, because it's not the same vaccine. How it works is totally different, and as it does not affect or interact with each other, you can do both vaccines at the same time, they said. I don't know about it. This is something what I heard. So you need to ask a doctor or anything about this. So I'm not a doctor. I'm only telling you about the things I have heard in the media, in the Turkish television, and or about the media in the world actually, basically. And for sure also what we have here on the street and what is the talk with the doctors here. So, in short, I'm going to get this Chinese vaccine if I can get my hand on, plus if I can also get my hand on AstraZeneca or Pfizer or any other one. If it's a different kind of vaccine, I would do that also. But this is only my point of view, and this is not definitely something, as I'm not a doctor, I'm proposing anybody else. No, only my point of view. So the situation here in Turkey. Today, well, we have the lockdown only on the weekends. That means after Friday evening, 8 o'clock, you cannot go out. Well, and you can go out again on Monday after 5 o'clock in the morning. That doesn't mean that you can't go shopping. So if you need anything, bread or some food or something to drink or cigarettes or anything like that, the shops are open. Well, the markets are open. All other restaurants, cafes, everything is closed. They are also closed within the week. And this is something very bad for the economy actually here. Well, the economy is already going bad. Although the authorities are saying something totally different. But the truth on the street is people are suffering really about this. They are not getting any compensation, definitely not. What they're getting, they open credits for them, cheap credits, but a credit is a debt. A credit is a credit. It's not something you give for free. So people cannot even get some credits. They close their shops, they sell their shops. It's not really looking good for all that economy there, really not. So, what will the next days look like here in Turkey? Well, what is said, and from the doctors is being said, is that we definitely need a close down for at least 14 days, even if possible for 26 days. And it really looks that way because the numbers are going up, the mortality rates are also going up, and I think at the moment we have a daily mortality rate of 211, that was yesterday, and it's not looking good. Also infections rates are going up, and this closure of only the weekends it's just stupid. Because at the end of the weekend, okay, nobody is getting out on the weekend, but within the weeks people are working again. They're using public transport, they're going to work, they're going to the office, and that doesn't mean anything. it doesn't mean anything. I can understand that the government doesn't have any money to back up all the people who are going to stay at home. But the question is money or lives? Well, the answer is quite simple, isn't it? So looking into the a little bit more far future, what I think is that December and January will go really bad. Although, as I said, the vaccine is coming. What they also said is they will get 100 million more vaccines until April. And until then, they will also talk with other companies like Pfizer, AstraZeneca, and other companies around the world to get more vaccines and other types of vaccines also. But we will see. I don't believe anything until I've seen it. And if they do not make a larger closure within December and January, although the vaccine is coming, I think the other months will be even worse. But we will see. Hopefully we will escape and endure this pandemic. Well, let's see. But this is the latest report, and I hope I will not do another one of these ones. So stay safe, stay healthy, and see you from Turkey.